Okay, hi everyone. Welcome to the Fall 2023 Pathways to Healthcare. My name is Savannah Fish, and at the Career Center, I'm an outreach and engagement intern, and I will be facilitating this event. With me today, I'm joined by two members of the Career Center team, Lisa Famulero and Beth Secchi. To give just a brief overview regarding the event, Pathways to Healthcare is designed to provide insight into careers within healthcare/life sciences that don't necessarily require a medical degree or equivalent. Today, we are joined by three panelists, Eric E., Dea, and Eric Z., who will introduce themselves. After this event concludes, the recording will be posted and sent to you all to look over, along with a document with their personal bios. Before we begin, just a reminder, if you have any questions, please put them in the chat. Now to get started, panelists, please introduce yourselves with where you work, what your job position is, when you graduated from UConn, and what your undergraduate major was. Eric E., if you want to start us off.
Great. Thanks, Savannah. Hi, everyone. I'm Eric. I graduated in 2018 from UConn. I studied biomedical engineering. Currently, I am a consultant at a firm called Health Advances, and it's a healthcare strategy consulting firm. So we work with a range of companies across different sectors and help them with their business problems.
Hello. Hello. I'm Dea, and I graduated UConn in 2017. I was a PNB major, physiology and neurobiology. And then I actually did a PhD at UConn Health in Farmington, the medical school. And now I work for Arvinas, which is a pharmaceutical company that has two sections, either cancer or neurodegenerative disorders. So I'm on the neuro side.
Hello, everyone. My name is Eric Zawodniak. I graduated in 2022 from UConn with a bachelor's degree in political science. I've been serving in AmeriCorps these past 2 years. This current term of service, I'm serving with 16th Street Community Health Centers, a health organization on the south side of Milwaukee, Wisconsin, teaching health education classes to many immigrant families about how to navigate a healthy lifestyle when you come to another country and how to live healthy. So I'm very excited to be here.
Thank you so much, panelists. So our first question that we're going to ask is, how did you find out about your career path, and what steps could one, say, student room take to get where you are in your career? And if you wanted to talk a little further about what you specifically do in your job too. And we can start off with Eric E. and kind of go in the same order, if that's okay with you all.
Of course, sounds good. So the way I found out about healthcare consulting was actually through UConn Career Services while I was a senior. I kind of came in and was unsure of what I wanted to do. I had recently decided I didn't want to go to medical school. So I was just coming in and exploring my options. And the representative from Career Services that I talked to introduced me to a few people working in different life science or healthcare fields. And one of them was healthcare consulting. So that kind of sparked my interest. I didn't end up going directly into healthcare consulting after college. So I did 2 years with Teach for America prior to joining Health Advances. And during my time with Teach for America, I really just solidified my interest in healthcare consulting by networking with different people in the field, as well as doing some prep work for interviews, preparing my resume and cover letter and whatnot. So that's kind of what led me to join Health Advances within the healthcare consulting field. And as I mentioned previously, so we work exclusively with healthcare companies, and that's across a range of different types, whether that be medical device companies, diagnostics companies, biopharma, digital health, or investors in any of those spaces. So it's a range of projects, and we help them on a lot of their strategic questions, whether that be to which market for them to invest in, which product they should launch, things like that. So oftentimes higher level questions that the management teams are thinking about and need outside counsel on. So yeah, that's kind of where I am today. And then in terms of what my day-to-day basis, uh, my day-to-day job looks like, it really varies, but I think coming in as an analyst, a lot of it involves doing primary and secondary research. So primary research being interviews with different experts, whether that be physicians or lab directors, depending upon what the project topic is, as well as secondary research. So looking at clinical literature or other publications from analyst reports and whatnot. So it's really very project dependent, but that's what it involves at a high level. And I will hand it off to Eric or Dea.
Hello. So my day-to-day also kind of differs depending on what project I'm working on, but essentially I do most of the work in the lab. So I'll work with different human cells or different like mouse models in order to find either different targets that could be beneficial for whatever disorder we're looking at. So for example, I do research with Huntington's, so we try to find different proteins of interest that can be targeted in order to lead to a drug that can eventually help patients. So a lot of it is wet lab work. But then I'll also have meetings, presentations. We'll have interns every year that I've helped mentor. A lot of reading, outside reading, keeping up with the literature, things like that. And how I learned about this job was that at UConn Health, they also have a group that kind of looks at alternative career paths that aren't academia based. So usually when you get a PhD, a lot of people, will do a postdoc or continue down that path and then eventually be a professor, have their own lab. I knew going into the program, I didn't really want to do that. I knew I wanted to go into industry. So this group helped a lot. They had different presenters every month from like consulting firms, from medical liaison companies, or like biotechnology companies, et cetera. So things like this are really helpful and can help you learn about the different avenues you have in the field. And what I really like about Arvinis is that you can do essentially the type of research I'm doing, even with like a bachelor's or a master's. They don't have a cap on your position. You'll just like start out at a higher position depending on what your education level is. But that is something that a lot of companies are moving towards because your level of education post undergrad doesn't necessarily equate to your critical thinking ability, your work ethic, things like that. So it was important to me to find a company that kind of also shared those values. So here we have people who are the same position as me with a bachelor's, things like that, which is great.
Yeah, so I can go next. So talking about my career path and how I got to my current job in healthcare, well, I wasn't expecting to end up here, but my love for social justice, my love for human rights took me down that path currently. Um, I first learned about AmeriCorps through my supervisor when I was an intern at the Career Center, Wiley Dawson. I told him about my love of service, and he recommended trying out AmeriCorps. And I ended up in Milwaukee, Wisconsin. I did my first term of service with College Possible Milwaukee. I'm a nonprofit that helps students from low-income backgrounds get into and graduate from college. And while I was in Milwaukee in this diverse city, I kind of caught the language learning bug, and I started learning Spanish. And our organization, 16th Street Community Health Centers, a big part of our mission is providing family-based healthcare, health education, and social services that are free from linguistic, cultural, or economic barriers. So it was a natural choice for me to choose 16th Street, my current organization, and kind of like my day to day are, preparing these classes we hold weekly for families, on the south side of Milwaukee. It's a lot of Hispanic, Latinx families, so Spanish skills definitely are useful for that, but we're also looking, there's a lot of refugees coming also from Africa, from Asia, onto the south side of Milwaukee. So we're also trying to hire staff with those language capacities. And it's given me like such a huge sense of, you know, certain privileges that I have that other people have, and certain privileges don't. Our healthcare system, it could definitely be doing a better job of serving marginalized peoples, whether that be in a linguistic capacity, in a cultural capacity, learning how to understand how to serve patients whose cultural values may differ from, my own or other people's. So it's definitely been a learning experience, but I'm happy that I've ended up here.
Thank you so much for your answers. So the next question that we're going to ask you is, how important was having an internship or other form of experiential learning during one's undergraduate in your opinion? And what would you recommend for your own career path? And we can start with Eric E. again, if you guys like.
Great. So I think having an internship and being involved on campus is definitely essential. It's something that companies are looking for when they're hiring full-time hires. I'm actually part of the recruiting team at Health Advances, so I do a lot of interviews with undergrad candidates, and I would say everyone has at least one or two internship or research experiences and is pretty involved on campus in different clubs. And I know that a lot of work goes into getting an internship. I had one internship during my undergraduate degree. It was a research experience it was in a lab associated with a hospital in Boston. And then for my junior year, going into my senior year, I was actually still abroad, so I didn't have the opportunity to apply for a second internship. But I would say internships and then being involved in campus clubs, and especially if there are any clubs directly related to the field that you want to get in, that's great. So whether for healthcare consulting, I think there's a consulting group on campus that does kind of mock cases as well as participates in case trials. So that something like that could be a great experience. So yeah, I would definitely highly recommend getting involved on campus, as well as pursuing internship experiences related to what you're interested in. I mean, for me, I didn't end up going into wet lab research, so it wasn't directly related to the work that I'm doing today. But I think just having that background in a related field is definitely valued, even if it's not exactly the field that you end up in as a full-time worker.
Yeah, I'll just reiterate what Eric E said. I completely agree, especially if you want to go into like any type of computational or like wet lab research based roles, you definitely need hands-on experience. It doesn't necessarily need to be a summer internship. What's great about UConn stores is that you have so many faculty with so many different variety of research that they all conduct. And so what I did my sophomore year was just look into different members, into like faculty members that I either had classes with or whose research I thought was cool, and just shoot them an email. And that's all I did. And I asked to be interviewed and potentially be a part of the lab. And once you get to know them a little better, you then can decide which one you prefer. And then I did most of my research experience that way. So while I was in school, taking classes, I also got a little bit of credit and went into lab once, twice, 3 times a week, depending on what your schedule looks like. So you do have a lot of opportunities at UConn, which is nice to get that hands-on experience. But then there are also summer internships that you could do as well. And if you do want to get a master's degree or go to a PhD program or even apply to work for a pharmaceutical company, you need that research. I don't think anyone is going to even look at your application unless you have some type of lab work experience.
Yeah, and I would say like the internship I had during undergrad, it really helped me develop skills that helped me land my current role with 16th Street Community Health Centers. While I was an intern, I learned how to write a great resume. I learned how to interview very well. But the most important thing I think I learned was, learning those professional soft skills, like how to communicate myself professionally, and also how to articulate my transferable skills and say, I have this experience working here. here are how I can transfer these skills to like a different, sector in the professional world. Because like I remember, this job is very focused on healthcare. I remember saying in my interview, like, I don't have a lot of experience like teaching kids about, healthy lifestyles, or I didn't, intern at a hospital, but I have these certain interpersonal skills, these organizational skills that I developed as an intern at the Career Center at UConn during my previous term of service with College Possible Milwaukee, you know. So just I feel like success in like your professional career, it can do a lot with just simply how you present yourself. And I recommend taking opportunities like internship opportunities that really have that professional development side, and also going to the career center while you're at UConn and getting consistent career consulting or doing like a practice interview. So learn how to express transferable skills. That was my takeaway from my internship experience.
Thank you. And kind of shifting a little bit to our next question, how did you find your job? And was it easy or difficult to interview? And do you have one piece of advice to give to the students in the audience about finding a job in the career of their choosing?
So I found out about healthcare consulting, as I mentioned, through UConn Career Services, but then did a lot of exploration on my own in terms of networking with different alumni who were within the field, both within healthcare consulting as well as more generalist consulting. And that's something that I would definitely recommend, is reaching out to UConn alumni or even high school alumni or any other organizations that you're connected with, even family, friends that are in the field that you may be interested in, or maybe able to connect you with people that are in the field you're interested in. Definitely very helpful to hear firsthand how people got into their roles, what they like about their current role and whatnot. And figuring out what you might not be interested in, for me, was just as important as what I might be interested in. So definitely would recommend that. You can reach out to UConn alumni on LinkedIn. Generally, people are very willing to schedule a 15 or 30-minute call to help you out. Or I think UConn actually has a career platform that you could also leverage as well. And then Savannah, could you remind me the second part of the question?
Yeah, if you wanted to talk a little bit about the interview process, and if you had one piece of advice for the students in the audience about finding a career or a job in the career of their choosing.
Sure. So the interview process with consulting starts with, I guess, applying. So the firms are pretty selective in terms of who they accept for an interview, just because they get so many applications. So highly recommend networking and having somebody on the inside of whatever company you're interested in that can pull for you and give you what we call a referral, which is basically saying, this is someone I'm familiar with, I've worked with them in the past, or I spoke with them and they seem like a solid candidate that I think we should give a chance to interview. So that was essential in order to secure an interview in the first place. And then in terms of interviewing for healthcare consulting, you have a lot of the typical questions that you get with companies, kind of why this company, what interested you in the field, tell me about X and Y experiences that you've had. But what's unique about consulting interviews is a large portion of the interview is a case-focused interview, which is essentially a mini simulation of a live case. So it's basically you're presented with a business problem and you work through it logically. It involves math and giving essentially a pretend recommendation to the client at the end. So that's something that's pretty unique and definitely required a lot of practice in order to get comfortable with, especially not having or not coming from a business background. And then in terms of advice, I think, just leveraging the UConn network and being very persistent in terms of what you want to pursue are two recommendations. I actually applied to my current company as an intern, interviewed and didn't get it, and then ended up applying for a full-time hire and got it. So definitely don't take any setbacks too hard. If you're interested in something and wanting to work for it, you can definitely get it in the end.
So the interview process for my job is in like 3 or 4 different phases. So the first will be you meet with the person who would be your immediate manager. It's usually like a 30-minute interview, and you just get a feel for each other, see if you're compatible with the team that they already have, answer some questions about your research background, life goals, things like that. And then after that, you either meet with some of the other members of the team or maybe their immediate manager. And then the third round of the interviews, if you get selected, you have to give a presentation. So it's usually 45-minute presentation of your research, 15 to 30 minutes of questions, and then there's usually like 6 to 8 30-minute interviews with different members of the company from all different levels. And then after that, if you get selected for the job, you'll also speak to HR, and that's where you'll discuss your benefits and salary and things like that. And that's the negotiation part of your job. I think if you're coming in with a master's that's research based, maybe they would also have you present. But at the PhD level, they definitely will. Masters and bachelors, you might not have to do that. So you'll just have like 2 or 3 rounds of interviews. And people get selected to continue throughout those rounds. For applications, honestly, I think just shoot your shot because sometimes it's luck. The number one thing is definitely cater each one of your resumes and cover letters to that company. I highly recommend cover letters. It just shows more of an initiative and kind of desire for you to have that job. But yeah, just if you don't even think you're qualified, just apply because what really matters at the end of the day in these interviews is just that you can sell yourself. If you know you can put in the work and learn whatever the company is working on, your background doesn't matter, and the people at the companies understand that. I did my PhD on rare genetic disorders, and I looked solely at RNA and DNA, and the company I work for now is protein-based, something I never did as a PhD student, but I knew that I wanted to grow the skills that I had. And in order to do that, I wanted to be in a completely different type of field. So it's really just about having confidence in selling yourself and knowing what you're worth as a worker. And what was the first part of the question? Oh, how did I learn about the job? LinkedIn was a huge help. I knew what general area I wanted to work in, so that helps a lot, right? If you know you want to live in New York or Seattle or wherever, Boston, those are like kind of the major hubs for research, then you can narrow down your focus and then you can search based on what type of research you're interested in, right? So Google and LinkedIn pretty much help me the most.
Yeah, so I love talking about interviewing, and with interviews these days, it's a lot of tell me about a time questions. Tell me about a time you faced this situation, or tell me about a time you used this skill. And I recommend to just like keep a running list of experiences that like show your skills and growth and like practice, like giving those responses, and also talking about how they relate to a field in healthcare, if that's the path you want to go down, or even before you apply to a job, it's good to show interest and curiosity in an organization, like sending an email to the company even before applying, asking questions that you're genuinely curious about and can't be found on the website. And during the interview itself, also have the mindset that you're interviewing them, the company. you know be curious, like ask questions. I like to ask questions that go even beyond the scope of my role, just because I'm curious and I want to show my interest in the larger organization. And especially if you want to do healthcare work that's really embedded in the community. I actually met my current AmeriCorps supervisor at a networking event at the state capitol of Wisconsin, even before I really considered applying to 16th Street Community Health Center, because I'm like just involved in my city, in my state. So networking really helps. LinkedIn, talking to people, being proactive and putting yourself out there, and also asking for advice. I learned about this organization through my past supervisor at College Possible Milwaukee, So just being open, networking, and being curious. Those are my tips for landing the job you want.
Thank you. And our next question was, were there any other occupations or career paths that you were considering, and why did you end up going with the career you're in now? Eric, if you want to start us off again.
Sure. So I mentioned this previously. I was pre-med up until my junior year, thought for sure I wanted to go to med school. And then during my internship at Mass General Hospital in Boston, there was a career panel with physicians. And we just got to learn a bit more about what their day-to-day looked like, as well as kind of what motivates them and what they like about their job. And I found that it wasn't necessarily what I was interested in. A lot of them were spending significant amount of time doing research or doing paperwork, and I wanted something that was a bit more flexible. I knew that if I went to med school, that I was kind of locked in that role, so I wanted to be able to explore other things if needed. So that's kind of what led me to explore elsewhere, to work with Teach for America. Um, the reason I did that was kind of because I wanted to do something service oriented after college, and then getting back to something related to my major, pivoting to health advances in healthcare strategy consulting, where I'm exposed to kind of a variety of fields, and you have the opportunity to see if there's one particular segment within healthcare that interests you, and then you could potentially pursue a role within that industry, or continue working on a variety of projects. So yeah, I think that answers the question, but let me know if not.
I too was also pre-med at UConn Stores. And it was the summer after my sophomore year, I did a research program at with this professor named Dr. Stormy Chamberlain, and she looked at these three rare childhood neurodevelopmental disorders: Prader-Willi, Angelman syndrome, and Dup15q. And she kind of essentially changed the course of my life. She was just a really amazing mentor. She had really incredible top-notch research, and she was also extremely patient-focused. Like every times a year, she would see the patients that she was helping, do charity walks, and actively discuss with their parents and family members what exactly her research was doing, what type of drugs it could lead to, what pharmaceutical companies she was consulting with and talking to. And so I just had a really great connection with her and honestly idolized her as a mentor. And I was like, I'm going to do a PhD and I'm going to be in her lab. So that's kind of how my trajectory went. And, it kind of brings back to what Eric E. and Eric Z. were saying, networking, right? It's just putting yourself out there and talking to these different people can really change the course of your career and life path. And so, yeah, that's why I ended up doing my PhD with her. I was able to do different sorts of projects, meet all these different patients, go to conferences, as well as do a consulting internship with a small investment firm, Canaan, in Connecticut. So finding a mentor, if you do like a master's or a PhD, is also something that's really important to keep in mind, even in the job world, right? Having a manager that kind of pushes you and you appreciate and can have open and honest conversations with, and that will help you grow career-wise, is really important. So keep those things in mind when you're interviewing and when you're applying for these different jobs.
Yes, and if we're talking about like career trajectories changing, I got some good advice, from my supervisor at my previous AmeriCorps position. When you're just a young professional and you're starting out, bouncing around from job to job, like trying like different things, like isn't the worst thing in the world. I know the conventional wisdom is like you want to stay in a position, for a long time. You don't want to seem like you're uncommitted to an employer, but when you're a young professional, like that's the time to try things out and see what you like, versus what you don't like. I thought I wanted to kind of like stay in like the educational like equity field, but I thought I would be, closer to like the community and more active within the community if I took a role that was more focused on healthcare and healthy communities, you know, and just having that, also kind of like, shooting your shot. Wiley Dawson, my supervisor at UConn Center for Career Development, told me, not to be hesitant, take chances. Life is an element of risk. I took a big risk, like moving from Connecticut to Wisconsin. Like I took a risk of, switching to another AmeriCorps program that's more focused on healthcare, but those like changes I've made have been very beneficial, to my career, have helped me experience new things. And I'm just like any student here in this audience, like I'm learning, like I want to attend like, events like this where alumni are talking about how they got to where they are now. So just having that flexibility of being willing to, change paths now and then to see what you like, I think that's something that should be encouraged.
Thank you for all of those answers. Quickly, I received a question specifically for Dea. They were asking, why did you decide to pursue a graduate degree, and how did you choose which graduate programs to apply for?
Yeah, so even though 2017 wasn't that long ago, the biopharmaceutical layout was quite different. Especially during COVID, it's just boomed, right? There's just so much money in biopharmaceutical companies, and that's created a lot of jobs, which has given a lot of the power to workers. And so because of that, like it creates a space where like the last 3 years, you can really get these positions in different pharmaceutical companies with just a bachelor's or just a master's degree. It didn't used to be that easy to be able to even go into a research scientist position without a postdoc was, you know, 5, 10, 15 years ago, not that common of a thing. So the landscape has really changed. So when I was in school from 2013 to 2017, you kind of really needed a master's and a PhD to be able to kind of get the positions that I was looking for to be in. But nowadays that is different. These research associate positions, there's just more available, and there's a lot more job growth within that type of position than there was before. So, honestly, sometimes life is just about luck. So that's why I decided to go into a graduate program. And I chose to apply to programs where I wanted to live. I think it's really important to be, overall happy in whatever job or life course you're going to be. And so for me, my top priorities were mentor and location, because I knew wherever I was going to be, I'd put in the effort and hard work in order to be good at my degree, but I also wanted to be happy where I was. So I applied to schools in New York and Chicago and Connecticut because those are the three places I really liked. And honestly, my decision was kind of made because Stormy Chamberlain was at UConn Health. So even though I got into quote unquote better schools or whatever, I knew I wanted to work with her. So that's why I ended up choosing UConn Health.
Thank you, Dea. And I also have a question for Eric E. Could you talk a little bit about what kind of major requirements or recommended majors there would be to go into consulting, or if there was like a perfect path for it, what would it be?
Yeah, it's a good question. Really, there is no perfect path. I think that's a cool thing about consulting is, particularly with healthcare consulting, everyone in my firm has at least some experience in healthcare. The majority have a healthcare related degree, whether that be neuroscience or biomedical engineering or anything like that. But we also have people with business degrees, whether that be an undergraduate business degree who showed strong interest in healthcare, or people who have an MBA. So I don't really think there's any major requirement to get into healthcare consulting. You do have to demonstrate a strong interest in consulting and a strong interest in healthcare through your application and your experiences, whether that be internship or involvement at UConn. But I don't think the major is very strict to get into healthcare consulting.
Thank you very much. And Eric C., we also have a question for you. Can you share more about your team at 16th Street? Is everyone a part of the AmeriCorps program, or are there other full-time staff who have been doing community education work for a long time?
Yeah, there's a lot more staff than AmeriCorps members. I think I'm one of like four AmeriCorps members, but I like that ratio because I was at a program that had comparatively speaking more AmeriCorps members last year, and I'm just a pea in a pod of like many offices with on the south side of Milwaukee, many departments. My department is the Department of Environmental Health and Community Wellness, but we also have a lead prevention program that works to remove hazardous lead in pipes and homes. On the south side, we have a maternity program to help nursing mothers. We also have a program called, in Spanish, it's called Líderes por la Salud, or Leaders for Health, that seeks like community members and teaches them how to live healthy lifestyles, but also like how to teach that throughout the community. So I really like my current organization because it's just like so big and so vast, like so many departments. And one thing I can do as an AmeriCorps member, I can also do cross departmental work, and also get involved with other things. So that's another thing that I recommend you look at, like how big of like a program or organization do you want to work for, or do you want to work for like a small organization or like a really big organization? And there are like pros and cons to each depending on your tastes.
Thank you, Eric. And our next question is one that anyone can answer. It is, what outside or other skills did you look to acquire to be successful in your respective fields? And Eric E., if you want to start us out.
Sure. So the consulting role, I would say, is pretty unique. It's a lot of on-the-job learning. But in order to get it, you have to demonstrate that you're capable of succeeding in the role. So most of our hires don't have previous internship experience doing consulting, but they've demonstrated an interest in healthcare, whether that be through research experiences, etc. And some of the skills that I think you need to demonstrate, right, is being a fast learner, being collaborative, being able to break down complex concepts and findings and present them in a simple manner. And then, as I mentioned earlier, specifically for the case interview part, is just practicing your case skills and doing a lot of practice cases with the live partner was definitely something that was essential in order to improve my interviewing skills.
Some other skills that definitely helped be successful in this field, honestly, presenting is really, really important. You wouldn't necessarily think that, like you'd imagine a scientist is just at the bench all day pipetting, but being able to actually convey what your data means and what are the real implications of it or lack thereof, right? Is really important. And to be able to do that, not to just other scientists in your company, but to the outside world is huge. And that's something that I personally think a lot of scientists are missing and not able to do well, which can cause a lot of, confusion and misinformation and even for programs to stall or not be fully understood when it comes to different sectors, right, in the real world. And pharmaceutical companies at the end of the day have investors, right? So to be able to convey how this is going to help patients, what that timeline would be, what are the experiments that are necessary in order to go to clinical trials, things like that are really important. So what I've been trying to focus on now more in this position is kind of navigating that type of world, right? The little bit more of a financial world and kind of like health in general, right? Like speaking to like governments or officials and stuff like that to kind of advocate for different resources or treatments. So those are things that I didn't necessarily think were important for this job role, but now that I'm in it, I've been working on.
And some other things I wanted to learn in my current role, and I think AmeriCorps does a great job of providing this, is just like this like greater awareness of why these disparities in healthcare exist in my city, in the state, in the country, in the world. We have a lot of like really useful trainings that my AmeriCorps manager like makes us go to, that we kind of like talk about, the history of like redlining, residential segregation in Milwaukee, like trainings about like systemic racism and like healthcare, meetings with other organizations that are involved with addressing these disparities in healthcare in the community, so just kind of like learning and having that knowledge, and that's kind of like why I do recommend AmeriCorps to people who are like so hungry to see like social justice and change, is because like not only are you like serving like with your organization, but you get all these like additional like webinars, like events that you get invited to go to, where you learn about these things and why there are certain challenges in certain communities versus other ones, and just like for me, it's also been like learning how to be more culturally sensitive, and even learning, like why the people we're serving, like they even like immigrate, to this country from, the countries they are originally from, so just having that cultural sensitivity, the awareness of why these disparities exist is indispensable to providing, adequate healthcare to diverse communities.
Thank you. And we had a question in the chat from Noah, and it wasn't addressed to anybody, so anybody can answer it. They said, I know this isn't pre-med focused, however, that's a track that I'm still considering. I recently received my Bachelor's of Science in Allied Health Sciences, and I'm looking into some kind of specific healthcare entry roles. How can I leverage my experience / first degree to do so? And whoever feels comfortable can just unmute and talk.
So for med school, I mean, I'm biased, but I would recommend doing a research position at a university. I think you get, paid decently well compared to other like jobs, and you'll get that research experience, which medical schools are kind of really into right now. I mean, they have so many requirements, but research has become a lot more of a positive thing to have on your resume. I'm not sure if it's required, but it might be. So I think that also gives you flexibility. The good thing about research is that, your experiments are different each day. So you might have a lot of downtime one day, and then you can use that to study for MCATs, for example, or look into different schools that you are interested in, right? If you're really serious about the pre-med course, you really need to figure out like what are the top 3 things for medical school, MCAT, like the internships at hospitals, shadowing, and research. So getting a job that's flexible for you to focus on those 2 things, I think, is the most important. And with a bachelor's in science degree, I think you could definitely get a research position at a university, or even apply for companies that are near where you live.
Thank you, Daya, for answering that. So I have another question for Eric E and Eric Z. So Eric E, if you want to answer first, and then we can move on to Eric Z. But the question is, do you think you'll go to grad school in the future? And if so, what degrees will you pursue?
Yeah, it's a good question. I think it's unlikely at this point. If I was to go to grad school, it would be to get an MBA. And I'm currently in kind of the post-MBA position at Health Advances. So I'm doing the role that MBAs kind of come in and work on. But I think the rationale for potentially pursuing an MBA is you look more attractive to potential future employers. So I think if you have aspirations to be high up in a company, a lot of times those people have MBAs or advanced degrees, and you may potentially be skipped over if all you have is a bachelor. So although personally I don't think I'm going to pursue it, that would be the rationale for pursuing such a degree.
And Eric Z, do you want to answer?
Oh yeah. So to answer the same question, I've set a goal for myself where, I really want to go to law school and become a lawyer, and, even like my senior year of college, I was thinking, I want to work for like 3, 4 years, really do important community work to get, what's going on the ground level, before like I go to law school and like try to affect change through laws and, doing advocacy work as a lawyer. Like, I'll give you an example. Like, one important component of healthcare, of a healthy life, is simply having a roof over your head. But there's such a disparity in home ownership, in Milwaukee, because, there are a lot of out of state landlords, buying up properties in the inner city of Milwaukee, making it hard for low income Black and brown families to own their homes, you know, and it's renting can be very unstable. A landlord can raise rent out of nowhere and like displace you. I didn't even know that before coming to Milwaukee and like doing my work, but I'm so grateful that I learned that so I can become aware of that and have that knowledge going into law school when I eventually go. So that's kind of why I'm doing the work that I'm doing. When some people may look at it and say like, well, how is this exactly related to law? But I'm glad I'm having these like on the ground personal experiences, and I think that will prepare me well for law school.
Thank you, Eric. And for the next question we have specifically for Dea, what advice do you have for students who aren't sure what areas of research they are interested in? How do I find research opportunities or know which faculty to reach out to?
Yeah, so going to UConn stores, like I said before, is such an advantage. Like big universities have so many resources. So you obviously have different career departments that you could talk to. You could also talk to professors. I mean, if you shoot a professor an email, like shoot a couple, one of them is going to respond and then more than happily talk to you about their career paths, what they recommend, etc. I didn't know what specific research I was interested in. I knew I liked science. I had a bachelor's in science, but I didn't know what area I liked and wanted to pursue. So what you can do is you can apply to, it's called like biomedical degrees, and these are kind of umbrella programs where they'll have 5 to 10 different disciplines within that program and you do rotations, right? So there's a lot of PhD programs where you apply and you just have to know your lab and you go into that lab. I didn't apply to any of those programs. I applied to just medical schools because they had biomedical umbrella programs. And within that, you could rotate in neuroscience, cell bio, genetics, immunology, skeletal bio, at whatever you could think of. And so I did different rotations in completely different degrees. And I ended up choosing genetics. And that's the one I continued forward with. So that's a huge bonus. There are programs that allow you to kind of have a year to 2 years where you really try different experiences and figure out what works for you and what lab scenario works for you. I also think finances is something huge that we haven't really talked about that you should really think about. Masters are really, really obscenely expensive nowadays. And PhD programs in the science field don't pay tuition. Your tuition is waived, and you also get a stipend that you're paid every year. So while I was doing my PhD program, yes, it's 5 to 6 years I think 6.5 on average. I did mine in 5, but it is a long time, but I didn't accrue any debt while I was doing this program, and I also got paid. It's not a lot, but it's definitely livable. So that's just something else to keep in mind, especially if you do have loans in your bachelor degree. It might not necessarily be the right decision to immediately go into like a master's or whatever. It might make sense to work a little bit. A lot of companies also will pay you to do things like an MBA or a master's degree in whatever field you're interested in. So that's something that you could ask during your interview process.
Thank you, Dea. And we have one final question because we're coming to around the ending time. So the final question is, what's one final piece of advice you have for students who are interested in healthcare but aren't sure which career within healthcare to pursue? And we could start off with Eric E. again and go in the order that we had before.
Yeah, so I think what I said previously, just having as much exposure as you can to different industries is the biggest thing. So attending career panels like this and doing networking on your own by reaching out to people on LinkedIn or through UConn's platform are my biggest tips. You can get a good sense of what the day-to-day life and what the day-to-day looks like for people in each role as well as the backgrounds that they look for, and get a sense of if it's something that's interesting to you. And then if you talk to somebody that is in a potentially interesting field, you can talk to others in that same field to confirm, and really get a good sense of whether it's something you want to get into.
Yeah, I agree with Eric E. There's really no way to know what something is like unless you talk to someone in that field. You know, messaging people on LinkedIn. I've had random people message me and I've responded. So definitely just try. There's nothing to lose, by reaching out to individuals and getting their perspective on their field. And then also just working in that role. Applying for internships or applying for these different positions. It's okay if you end up taking a research job or a consulting job and you do it for a year and you don't like it. That's okay because you got that experience, you now know, and you're also going to meet so many people in those different fields that now you have a connection with that can let you know about a job application in their field or something that works for their colleagues, etc.
Yeah, just echoing, what was said, messaging an alum on LinkedIn in a healthcare related field, meeting with a career counselor at the Career Center to discuss and explore your options and find resources. Also, I think it's a good idea, to research, companies in the healthcare field and, email, people who work there questions or even ask for like an informational interview and show that interest, and just try to get all the knowledge you can. So when you take that step and apply, you feel ready and you have your research done and the company knows that you're a committed applicant and that you would be a good fit.
Okay, so that brings us to the end of all of our questions. A huge, huge thank you to the panelists for coming and speaking to everyone about their experiences and career paths. Just a few announcements and a reminder that this event was recorded and will be uploaded to the Career Center website. And a couple of announcements from the Career Center itself. NACE, the National Association of Careers and Employers, has identified 8 competencies that every graduate should work on regardless of their career path. And to learn more about these competencies and assess your career readiness, check out the Becoming Career Ready page on the Career Center website. Additionally, the Career Center has a number of career communities where you can continue to discover new careers, alumni, advice, internships, etc. We will put the career readiness page and career communities pages in the chat, which I believe was just done. And other than that, thank you so much, everyone, for joining us. Thank you so much again, panelists. We appreciate you all, and have a great, great night.
Thank you.